Welcome to this special Silicon Slopes Town Hall. Today we announced the launch of testutah.com. What happened today is a testament to the power of community and to the spirit of collaboration that exists in Utah. Silicon Slopes has launched testutah.com in partnership with the state of Utah, Provo City, Orem City, Nomi Health, Co-Diagnostics, Domo, Qualtrics, ATL Technology, Safe Lane Health, Provo Town Center, and RPH Engineering. We have a lot to cover in this town hall, so I'll make my opening remarks brief. First, I want to thank Governor Gary Herbert, Lieutenant Governor Spencer Cox, Speaker Brad Wilson, President Stuart Adams, Nomi Health CEO Mark Newman, Inside Sales founder Dave Elkington, Domo CEO Josh James, Qualtrics CEO Ryan Smith, Traeger Grill CEO Jeremy Andrus, the Executive Director of the Governor's Office of Management and Budget Kristen Cox, IHC CEO Mark Harrison, University of Utah Health CEO Michael Good, Co-Diagnostics CEO Dwight Egan, the amazing folks at ARUP, Dr. Angela Dunn, and so many others for recognizing how critical getting every Utahn tested who wants to be tested is, and for their leadership in driving us to where we are today. I also want to thank and recognize all those on the front lines of this pandemic, our heroic doctors, nurses, technicians, and all medical personnel. Thank you for everything you're doing. You're saving lives. Today, together with hundreds of individuals and companies in the state of Utah, as I mentioned, we launched testutah.com, an ambitious effort to get every Utahn to take a COVID-19 assessment and drive toward getting every Utahn tested for COVID-19. We've called this initiative the Test Utah Challenge, hashtag Test Utah Challenge, to crush the curve. You'll see it on social media today, and we encourage you to use the hashtag to drive everyone you know to testutah.com. This effort is a public-private partnership that has essentially open-sourced healthcare through an incredible tech stack, fantastic local hospitals and labs, and volunteers from so many different sectors throughout the state. We want to be, and by we, I mean Silicon Slopes and the testutah.com effort, radically transparent in this process as we scale up to meet the incredible demand for these tests. We appreciate your patience in that process. We will be here communicating the latest on what's happening with testutah.com and Slope Serves on a daily basis via our social media channels and YouTube. What we'd like to do this afternoon on this special town hall is go a bit deeper into how this came together and how it works. With that, I'd like to hand it over to the man who made all of this possible, Governor Gary Herbert.
Well, thank you, Clint. I'm honored to be with all of you. This is probably a perfect example of the concept of team. We all know about teamwork, and everybody on the team has a role to play. I've used that acronym many times in the past, team, T-E-A-M, to mean together everyone achieves more. This is an example of people coming together, seeing a challenge and a problem. We appreciate so much the private sector stepping up, as we've seen many times in the past, and here really a full court press by Silicon Slopes to help us improve our testing capability. As most people know, if we can test everybody, we can find out who has the COVID-19 virus and who doesn't. And certainly with our ability to then track and trace people, we can isolate and we can be more selective in how we in fact go about directing our resources and actually not only slow the spread of the COVID-19 virus, but stop the spread of the COVID-19 virus. So today's announcement of additional testing capabilities where we actually screen people, help direct them to testing facilities. We appreciate the fact that there's 2 new ones being opened by Silicon Slopes. I think one down in Timpanogos Hospital area in Orem. I think one down in the shopping center, South Provo Shopping Center. So 2 areas.
The Provo Town Center, Governor.
Provo Town Center. And I think that anticipating over the next week or two to open up 6 more, each one of them capable of doing 500 tests per day. So that'd be an additional 3,000 to 4,000, I think we hope, to add to what we're already doing with our Intermountain Healthcare, our RUP, our state testing lab, to get towards our goal, which we feel like we need to get to by this next week, is 7,000 per day, which is really going to help us bend the curve. So I like the phrase you got, crunch the curve. We're going to have a crush the curve, I guess it is, crush the curve, and everybody's going to be involved in that exciting new kind of movement to join forces and all of us do our part. So I'm really excited about the help you're bringing at Silicon Slopes. I feel good about where we're at. I feel good about our plan that's being implemented in total. And we have the most comprehensive plan of any state in America today now. And you guys have just helped augment that in a significant way today. So thank you so very much. I'm excited about what we're doing together.
Thank you, Governor. And I really appreciate your leadership. I know I speak on behalf of the entire Silicon Slopes organization when I say that, and then the whole community. Today is a significant day, and the fact that we're ramping up testing in Utah is a really big deal. I want to go to the head of the coronavirus task force for the state of Utah and our esteemed Lieutenant Governor, Spencer Cox. Lieutenant Governor.
Thanks, Clint, and Governor, thank you for making all this happen. Clint, to you and your team, we're so grateful. Grateful for the late night texts and calls with everybody that's been working so hard to make this happen. As you guys mentioned today, there are really 3 important parts to what we're trying to do, and testing is one of those. But it's critical. It may be the most important part, but the other 2 are very important as well. There is an assessment piece of this, and really I think it's important to understand what we're trying to accomplish here, and what we want to do is I mentioned this in the press conference, but it's important to know kind of how we got here. And unfortunately, because there were some mistakes made early on in this process, we didn't get tests to try to figure out early on who had this. That's why we're implementing these pretty extreme social distancing measures, because that's the sledgehammer approach. We got to flatten that curve before this goes crazy. But we all know that there's a limit on how long we'll be able to do that. And the way through this, the best scientists, the best researchers, if you look at countries that have done this, there really is only one way through this until we have the medication that's going to prevent this. And that is that we have to over test, figure out where this is, and then tracing. So you find out who has it, then you find out everybody they've been in contact with, and you test them, and you isolate everyone who has been infected with the disease. That prevents the spread from multiplying. And so there's an assessment piece of this as well. And on your website, on the testutah.com website, people can go on there, take that assessment, which will help us understand, get a better idea of who's exhibiting symptoms, find out if we do have some hotspots. There's some really disturbing stories out there. One, I believe, is in the state of Washington, where a choir group, one person was infected and infected a whole bunch of people in that choir. Towns in Georgia where there was a funeral and it spread very quickly in Georgia. And so we know there are some places that are being under-tested. Utah County is one of those places. So opening these 2 facilities in Utah County is huge. We're talking to the mayor of St. George. We want to make sure that we have lots of testing down there. But again, the best part of this is the way it all came together. You guys have done in a 2-week period what would normally take upwards of a year to accomplish, and that's what's happening at the state level. It's happening all across the state. I have told people, please be patient. There are going to be bumps in the road. There will probably be bumps with the survey we're doing. There will be bumps with the testing. We're working through this together, but we're doing it because of you guys, and we're just so proud of your great work. So thank you.
Lieutenant Governor, and again, on behalf of the Silicon Slopes organization and our whole community and all of Utah, honestly, thank you so much for everything you're doing. I know that I don't even know if you sleep. Thank you for everything you're doing on behalf of our state and leading this task force. It means a lot. We appreciate you. Now I want to go to Utah Senate President Stuart Adams to talk about this partnership. President Adams?
Thank you. As you look at the challenges we're facing, I've looked at my entire life and probably talking to other people, there probably hasn't been a time in the history of the state that's been more challenging as we look at this pandemic. And you look at what we've been through before, even World War II was extremely challenging, but we've never had anything like this that's actually challenged our economy, challenged our health system, challenged our own personal health, challenges the things that we love and hold dear. We're worried for our families. We're worried for those around us. We're trying to figure out how to solve this problem. It's almost as if we're at battle or have some type of war against this pandemic. At any time this has happened to America, what has happened is we've stepped up. We haven't stepped back. We haven't waited for other people. We've actually found a way to innovate and try to solve problems. And I will say that no one innovates better than people in Utah, and no one innovates better than people in Utah than Silicon Slopes. And your leadership has been so instrumental in actually trying to solve this problem. You know, when I was in school, I had always wondered how to answer questions, and you'd have A, B, C, D. My answer was always, if I didn't know, all the above. And I think here we have the same answer, all the above. We want a social distance. We want to test. But this survey is so critical to be able to test Utah, to be able to get out, to get the information out and be able to gather that data. And again, no one does it better than the people, the partners that you mentioned at the beginning of this broadcast. I'm extremely happy to be a part of it. You see the public sector, government, state, local. You see business people. You see entrepreneurs. What a great spirit of America, the spirit of Utah that you represent here. We hear a lot of negative news. Today is positive. We are going to get on top of this. We're getting on top of it because of great people involved in this. I can't tell you thank you enough. It's been a great thing to be involved with. Not only are we going to test, but we can treat. We have ideas of treatments. We have different thoughts, whether it's hydroxychloroquine or remdesivir, I don't care what it is. If we can find these people, locate them, isolate them, find their friends, find some treatments, we can bend that curve, bend that demand curve on our hospitals, reduce the need for ventilators. We're going to do this. And again, I'm very thankful and grateful and excited to be a part of it. Thanks, Clint, for your great leadership.
Thank you, President. It's appreciate everything you've done to get us to this point and everything you and the legislator are doing. It's really remarkable. I also want to acknowledge Speaker Wilson. He's not able to be on this call at this time. He may be coming on a little bit later, but Speaker Wilson has also been an incredible leader during this time. And with that, I want to go to the brainchild of all of this and the guy who rallied the entire Silicon Slopes community around this idea and around this initiative and got us to where we are today. Nomi Health CEO Mark Newman to go through the whole flow of how this all came about. Mark?
War stories and fairy tales. As we've gone through this, and I'd definitely like to highlight the state support that we've had in this up and down the stack from the governor, lieutenant governor, President Adams, Chris Cox, and other people who've just been supportive. And frankly, when we've hit hurdles we didn't think we'd get over, this said keep going. And I feel like that's what Utah's hallmark is that we just keep going. And we figure it out and we do the hard thing. If you think about what we've built here, it's one, as Clint mentioned, an open source version of healthcare where we want to break apart any single critical dependency of the supply chain for testing. We didn't want to be beholden to any giant, huge robotic machines or any traditional processes. We didn't want to have only one single swab or one single extraction kit or one single machine that would run it or one single way to do it. And we needed to cross-validate across all of those pieces. That's enabled us to have a large, massive volume of tests to be able to do. And I'd encourage other people to go out and read articles in the Washington Post about other cities and locations. This is a national problem. Michigan right now, the mayor of Detroit was grateful to get 5,000 tests to be able to treat and screen first responders. The second part of this is that we actually brought together some of the great technology platforms that exist inside the state and married that with experiences we've had. So for instance, building HireView before building Nomi Health now, we built massive population level assessment programs for hiring. SafeLane Health has built massive certification programs for healthcare and been working with President Adams and the health department on that for the state. Qualtrics is the largest survey platform in the world to be able to power this. And so that is the way to think about it, is top of the funnel. right? We needed to cast a wide net across the top of the funnel, across everyone inside the state to be able to get the symptom checker, get the pre-screen, the pre-assessment survey that everyone needs. So call that 2 million people, digital assessment for everyone. The next part of that is we built the science around it. We partnered with Levitt Partners, the state organization, the state health department, building out the state clinical testing protocols, and wanted to first go through a mindset shift of a mindset of limits in the sense of we only have 200 a day, what are we going to do, to what if we didn't have critical constraints on capacity, what would we do then? Well, it turns out we want to be able to assess the people who take care of us, the people that raised us, and the people coming into the world. Right? So we've got first responders, healthcare workers, patients inside of hospitals, the elderly in our community, people displaying symptoms, getting a handle on this. And when we don't have that restraint of being able to do an enormous amount of testing, how would we think about it differently? So from the top of the funnel, put in science, brings us down to about 100,000 to 200,000 people plus that we want to get physically tested no matter what. Then we get into capacity constraints. How do we actually have an effective flow? If you've seen testing in lab locations across the country, where it's broken down is when there are 400 people in cars waiting for hours trying to get tested, or ERs being inundated. And so we partnered with Incorporate Massage and other scheduling organizations, and we're going to keep working on through that, where we could actually set up capacity and efficiency into the system. So once a person goes through the funnel, does the digital assessment, then gets told to take a test, then they can actually self-schedule at the time where it works for them and where it works for them. So we have the Provo and Orem locations to start. They could pick 10:05 to go show up. That is an effort to maximize throughput and make it so people can do this on their own time. What I'd implore the community to do, though, is if you take a spot, you show up. The worst thing we could do is waste spots. And because that is like airplane seats that fly away empty. We want to make sure anyone that can get a test needs a test, that abundant testing is available for anyone. And we want to build it out to next everywhere. So we started in Orem and Provo. We're going to be adding 5 to 10 plus mobile sites. They have 500 plus a day opportunities for people to go get tested. And we're driving results and feedback time that haven't been hit in the state before. The big providers have been absolutely inundated, and we've seen response time go to 5 to 7 days. So far, we're at 24 hours or less, and we're looking at a 24 to 48 hour window that everyone gets their response. So think about it this way, a stitching together of great technology partners, a funnel that everyone can kind of go through, and scale that we can touch every single person in this state. We couldn't be more excited about getting Co-Diagnostics, a terrific local company, involved on the testing level. Appreciative of all the technology partners that have come together to do this. And I'll tell you, there's been magic happening with Ryan at RPH Engineering and other organizations where we'll have all the stories at some point, but figuring out firmware updates to have a machine run 3 times faster because it only has to cover X spectrum for testing is just insane, and really kind of the hallmark of innovation we have going here in Utah right now.
Mark, I want to go to, thank you again, Mark. Without Mark Newman, none of this is possible, everyone. I just want to point that out. And you've really kind of pivoted your whole company, this startup, Nomi Health, into tackling COVID-19. So thank you for everything you're doing. I really appreciate it. And I would encourage everyone to, take a screenshot of this thing. Maybe we'll push it out on social media as well on the whole flow of this thing. We'll come back to you here in a second, Mark, but I want to go to Inside Sales founder, Dave Elkington, who, again, without Dave taking the lead on this on behalf of Silicon Slopes on the operational front, we're not where we are today. Dave, can you talk about the operations of testutah.com?
Yeah, and I'd love to share a little bit of how this happened. So you said it right. Really, the state was amazing, right? Where we had the governor and we had Spence and really, everybody, the Senate, thank you. Like, it's been amazing. But about 2 weeks ago, we were talking about testing. We were talking about providing supply. So this got started by saying, hey, what can the private sector do? So first, Mark and the Nomi Health folks said, let's coalesce our energy and let's go find masks and let's find gowns and let's find shields. and we're finding them in like closets of like dental offices. And so we're scrapping, right? And it goes really well. And we're like, wow, that's kind of like, we can do something, we can actually help. So the next thing we said is, look, why don't we see if we can help with the testing? Let's see if we can get testing supplies. And we found Co-Diagnostic, and they just gotten their provisional approval for this COVID-19 test. And it's amazing. They're in our backyard. They do testing for viruses in third world countries, and they were able to apply it to this specific virus. And so we're like, how is it possible? We have millions of supplies to do this test in our backyard, yet we're not doing enough tests. So we're like, let's do something. So I called Mark 2 weeks ago, and I'm like, okay, where are we at? And he's like, where do you want to be? Like, what should we do? And I'm like, what do you mean, what should we do? I thought you already had this. And so it began an onslaught of calls to, Lieutenant Governor Cox, and really just, we started calling everybody. And what's been amazing, the thing I want to share is everybody helps. So I'll share a little bit about the operationalization of it, but the thing that has blown my mind, and I'll give you an example. So our hospital partner they're providing the lab, they're providing the medical workers, they're manning the tent for us, and in almost every case on their dime, right? So I didn't know the CEO of this hospital. I pick up the phone, I had a connection like thrice removed. Pick up the phone and I say, hi, so-and-so, would you be willing to do this? He's like, yep. I'm like, wait, don't you want to know what we're doing? He's like, no, it's a great idea. Someone needs to do it. We're in. We call just across the board. There has been a coalescence of hundreds of people. So right now, this effort is a massive group from the government. I mean, so what you just saw is support from, really the governor all the way down to, we have people who are, moving coolers down in the Provo Town Center Mall. I was there this morning. They've got people bringing bagels for free to help the workers. Like, that's what's going on. This is Utah at its best. Like, I am inspired. I get the chills when I think about it. So that's what's happening right now. And there's innovation that you would never get in the normal situation. And again, you gave one example, and I actually think it's important enough so you guys understand. The testing process is a complex process, and there's multiple steps for it. So we have people sourcing from all over the world, different elements of this. There's bottlenecks in this thing. And the reason this is such a problem in America is because it is not simple. They're complex, they're expensive machinery. So we've got a machine that runs the analysis of the test. We have an engineer who's volunteered his time. He's RPH Engineering. He was the inventor of the ring. You press the doorbell, it's got the camera. So he's watching this and he's looking at this test and it evaluates. He's like, wait a second, it's a 75-minute test. He's like, but after 45 minutes, we don't care. It's testing other things. He rewrites the firmware of this hardware, of this piece of device, by doing just that. And he did it at somewhere between like 2 and 4 in the morning, because he's texting me. He's like, I got it. I just doubled our throughput by rewriting the firmware of this hardware. So what we have is brilliant people, some who know healthcare, some who don't. And the fact that they don't has made things, they don't come with any preconceived constraints of what can and can't happen. So we've basically disrupted every element of this workflow. So now let me actually tell you pragmatically what's happening. We're sourcing there's basically 3 elements to a test. And again, we are going to be radically candid. We're going to show you everything we're doing. There's a swab. They put it in your nose or your mouth. They then extract the RNA from the swab. They put it in a test. The problem in America today is you can't get the swabs. You can't get the material to extract your DNA or that RNA to test it. We have people sourcing it from all over the world to solve this problem. Next, we've got, we have these volunteers. So we're collecting samples. All of us, as we feel crummy, we go to these sites. There's, again, these 2 sites. They're manned by volunteers. They're manned by, by people that are being provided at no cost to the community to take the samples. Okay, great. It goes into a lab, and we've got an entire validated lab. So this has gone through several levels of validation, meaning they take 20 samples that we know have the virus, or 100 samples that have the virus, 100 samples that don't. we run it, and we make sure that every aspect lines up with the state lab. And the state lab is lined up with the federal lab. So what we're doing is we're making sure every aspect of these processes are valid, they're tested. We're partnering with again, Angela Dunn. I mean, the entire organization that's associated with making sure we're providing as good a service as we possibly can. Then we've used tools like Qualtrics that manages the workflow. We're using Domo for dashboards. We're using Corporate Massage for scheduling. I mean, and everybody are just coming together. So the short answer is we've built a workflow, and if there's any failure point, we've got different vendors, different suppliers. We have volunteers. We have people that are backing up those volunteers. So look, we know there's going to be stuff that breaks. You start anything, and there's going to be things that break. But we're trying to build it in a way that we can pivot and adapt fast. So today we've done over 4,000. This was out as of 2 hours ago. 4,000 assessments on this website, and we've had a bunch of problems. Sometimes it didn't flow the way we wanted, and so we get feedback from you, and we fix it. And then we're going to fix it, and we're going to fix it. And pretty soon, it's going to be pretty good. And the better it is, the better we can provide the needed data to the scientists and to the state health department, so that they can then begin to isolate, identify where the hotspots are, be able to provide better treatment, be able to do better isolation and communication. So like, this is a massive collaboration with volunteers. I mean, I'm telling you, at some point, go just drive by. Don't get in their way, but just drive by one of these tents, and you will see an excitement and an enthusiasm. And we need that today. It's so down and depressing to listen to the news, but there's good stuff happening, amazing things happening with amazing people. So look, we'll give you updates every day. When we have problems, we're going to tell you, and when things work, we're going to tell you. But this is a community effort. We're just trying to do this. Like every one of these founders, we're doing this because we have families here. There's no other reason. Like, we care about the community, we care about our children, we care about our parents. Like, that's why we're doing this. So if you feel like we can do something better, let us know. Like, we're people just like you, trying to figure out how to solve problems.
Dave, thanks again for everything you're doing. I mean, again, like without you, testutah.com doesn't exist, and everything that you've done. I really appreciate it.
It's
for you
a group
taking the
effort.
lead.
It really is.
And now I want to go to the man who came up with the Crush the Curve campaign. He's a supply chain master. Who knew? I had no idea. He's such a great guy in the supply chain. My good friend, and everybody knows him. He's the Domo CEO, Omniture founder. He's the coolest guy in the world. Josh James.
Hey, thanks, Clint. Yeah, definitely excited to be involved with this. I got a call from Dave, and it's been crazy to watch Dave. I know he had a startup called Inside Sales, as most people know. It's now at Zant, and I saw him a month or two ago, and he was like, "I think I'm getting ready to start something else," and he gets thrown into this. So this has been his full-time gig, and I'm sure by the time we're done with this, he's not going to want to do another startup. But
I'm definitely getting my fix. I think yeah. I'm back to. I need some more time in Hawaii again.
So it's been so awe-inspiring for me to see everybody come together as much as they have, and really, I like giving shout-outs and really applaud Mark Newman, who had this crazy idea. I would have never had the idea. I'd be like, "Oh yeah, testing, sure, I'll figure that out." And he said, "Well, I've done an app where we did interviews for people on video, so I could probably figure out testing." But that's what he thought. And just really applaud him for what he's done and getting the thing started, and his whole team. And I'm sure everyone's been saying it, but there's hundreds of people that have been involved with this. I'm here to talk a little bit about what we're doing with the campaign to get the word out there, because as you know, as we've all watched on CNN, MSNBC, Fox News, and everyone else, there's a big movement to not be tested, and to have everyone say, well, if you have symptoms and you're young and you don't need to go to the emergency room, you don't need to get tested. Well, that's when we don't have tests that are available. But if you really want to make this go away, if you really want to get Utah back to work, if you really want to get Utah back in the swing of things, if you really want to get Utah back in business, then we have to be able to test and trace and understand where those hot spots are. We need to be able to test not in 5 days. We be able to test, in under 24 hours. and have plenty of tests available. And so it's been cool to see, the state, the governor, and others say we need to get thousands of tests a day. So having us all come together, Dave gave me a kind of a 911 on a Friday afternoon. Hey, can you figure out the rollout, like the campaign advertising? You're good at that. Can you do it? Yeah, sure, I got it, Dave. Which means that I call the people that I know that are good at it, and I recognize good. So we had a team of folks work on it, and actually one of our employees' spouses, who used to be a national account manager at Publicis, a very large agency. His name's Kevin Kehoe. He's an artist now, but he had this idea, and we kind of went running with it and tweaked it and kind of made it a little more viral. But the idea that we're going to roll with is later on today, we're going to see a couple of the jazz players start our campaign off. And the campaign is going to be, if you go to the site, testutah.com, there's 3 things that we need to do. We need to assess, we need to test, and then we need to trace. And so there's 3 things. And so the idea is you're going to see people grab a mic or a fake mic, testing 1, 2, 3. Hi, this is so-and-so, and let's get Utah. And for instance, if it were a jazz player, let's get Utah back in the game. If it's the governor, it might be, let's get Utah back to work. If it's me, it might be, let's get Utah back in business. We've got some really cool ones coming up. I think Tony Finau, I saw the golfer. Ryan Smith knows him really well, and he did a really cool one. So we've kind of got the first couple levels of the calling tree set up, if you will. And it's the Test Utah Challenge. So that'll be the hashtag. Instead of doing push-ups or an ice bucket challenge, we're going to see if we can get all Utahns to do the Test Utah Challenge. And you do it by mentioning 5 other people, and you highlight testutah.com, mention a few people, and hashtag Test Utah Challenge. And this thing's going to start rolling out. So I think we're going to see some really cool ones, some really creative ones, and would love to see all of yours. And so just looking forward to rolling this thing out and getting people's mindset back to everybody needs to go and assess, everybody. So that's the first step. Second step, if you're sick, we'll get you tested and we'll get the throughput much faster than it's been. And then the third thing, start figuring out where those hotspots are and who those people have been in contact with in rapid order. So that's the idea behind the campaign. And we're just, proud to be a part of it. And again, recognizing some good ideas. I was able to do that. I recognize the good ideas, and now we're rolling them out and pushing them forward. And we've got a lot of people across the state that are excited to be involved.
Thanks for everything you're doing, Josh. Really appreciate it, my friend. Yeah. Can you talk about the supply chain and how you figured that out?
Yeah, sure. I was inspired by Mark, to be honest with you, when I saw that there's a guy that has no business doing testing, and then Dave jumping in. I'm like, Dave, I know you can't do testing. I was sitting there, and I saw President Trump say that we can't get it's every governor for himself. Like I vividly remember hearing that. I'm like, what? This makes no sense. Like I feel like almost every entrepreneur I know could be responding better right now from a federal perspective. But it is what it is. That's where we're at. And when I heard every governor for himself, I thought, well, that means, we're not the big boys on the block here. So we're going to have to scrap. We're going to have to fight. I was on the board of a company, Stance Socks, that, brings in a couple $100 million of socks. I know the guy that was running the import export. He ended up going over and starting a factory. I know he knows people over there really well. And, when China heard the president call it the China virus, things start getting shut down. When China starts getting a bad name because there were some bad tests, faulty tests in Italy, they squeeze the choke point even more. And so it becomes even trickier to get stuff out. And then we get last in line. And so, I've been proud of seeing how quickly the government was willing to move and say, yeah, we'll buy some PPE. So I just started calling, had my contacts start calling, and we lined up a bunch of PPE. We lined up a ton of masks. We lined up a bunch of test kits. And it's all on its way over here from China through all these connections. And thankfully they had people in high places that were on the board of those organizations over in China, and that's helped us, figure out how to get through all the processes that exist over there. So yeah, just again, just hustling. That's what we do in Utah, right? We're all hustling.
Thanks again, Josh. Appreciate everything you're doing. TestUtah.com. It's the Crest the Curve campaign, the Test Utah Challenge. Go to testutah.com. And as Josh mentioned, a lot of folks are about to be tweeting, and that social media campaign is rolling out probably as we speak. Now I want to go to Qualtrics CEO Ryan Smith to talk about the assessment portion of this and the role that Qualtrics has played in all of this. And by the way, Ryan, great hat.
Hey, thank you. I'm always supporting, now more than ever. Hey, look, I think when we, if you think back a couple of years ago when we started Silicon Slopes, the idea was that we'd come together and be ready when things would happen. Every idea we've ever had, including Silicon Slopes, started off really bad, almost like, what are we doing? And didn't feel right. And then they evolve over time. This is definitely one. I remember when Mark called and we all got together. First idea was kind of like, okay, this probably, I don't know if it's a good use of our time. And then 2 or 3 iterations into that, it's like, okay, we're doing this. And this is what happens. From my perspective, at Qualtrics, we've got 25 offices around the globe. So we've been unfortunate or fortunate to see what happens when cities, governments get behind the demand curve and they actually don't reach out to the private market with those folks that can help in enough time. They run into massive issues. And so this is a natural step they all take. The problem is in our country and around the world, they're often doing it too late. So I want to applaud our government for actually getting ahead and saying, hey, testing is going to be most important. We need to get ahead of this. And we need the ability to pop up testing facilities. Just because we have capacity doesn't mean we have capacity in all the right areas of Utah. I was watching our assessments go all over the world, everywhere but Utah. If you go to the CDC site in New Jersey, we're seeing how they're using and measuring everything on Qualtrics. So when Mark called, they said, hey, can't we do this on Qualtrics? Yeah. Can't we get a QR code? Yeah. We put our engineering teams on it and empowered it. And it'll probably be one of the largest healthcare assessments. It's important that everyone takes it, primarily so that we can see what happens. If anyone knows someone, which I'm sure everyone is getting to that point now, who's contracted the virus and you've interacted with them, it's a scary time because they're calling and retracing who they've spoken with. And I recently was in a situation where someone was close to me and said, hey, by the way, I've contracted COVID. We were together a couple of weeks ago. This is what's happened. And you're retracing everything. So this is why it's important for folks to get tested so that we can really crush the curve. So we're happy to help. We're doing it all for free. We're already seeing other states watch what's going on. We're reading articles of where engineers in Silicon Valley are hacking ventilators to make sure that they can fix them and that they're more productive. But reality is, I think what we're doing by having an open source supply chain, which is the problem that's happening across the nation, is our supply chains are being completely disrupted, and getting ahead of that with no single failure point is what's going to make Utah different. So I'm just excited to be a part of it.
Hey, let me jump in for just one sec, Clint. I need people to understand. After I called Ryan, he said, "Hey, let me get you, one of my guys." And I think, at first Ryan's like, "Yeah, of course I'd help." Well, pretty soon his guy, brings 5 more people. Soon it's 8 or 12 or 15. Ryan's got a team. I don't know how big it is. It's got to be 10 or 15 people deep, working, from what I can tell, 18-hour days. Not hyperbole, literally working 18-hour days. They were up last night. I was on with them at 2 a.m. They were up at 4 or 5 a.m. So, and is just as he said, we had a conversation. I'm like, okay, Ryan, it feels like you guys should be compensated. Ryan's like, no, Qualtrics will not make any money from this. So I think there's always a little bit of cynicism. This is the effort that Utah, and it's not unique to Qualtrics. This is the kind of community that's emerging out of these kind of things. So there's a silver lining. I just feel like people forget about all of the good that's happening right now, and they're focusing on the bad. There's so much good.
Yeah, and people are gonna, I mean, we even see it with the questions. People want to be skeptical. They want to write stuff. They should know by now. We're all just trying to help because our families are here. Like, there's nothing else to read into. There's no angle with
There's no
any
depth
of
to
it.
it.
You know, if we were trying to make money, this wouldn't be where we put our efforts. We're here to help, and that's what Silicon Slopes is about.
Yeah, I appreciate both of you clarifying that. And I mentioned this at the press conference. No company will be making any money off of the testing. I believe there's, there's other aspects of this that I think make sense, but where it's the supply chains and different things where it'll make sense, for companies to do what companies do. But on the testing piece itself, no Utah tech company is going to make any money off of that. And so with that, I want to go to Jeremy Andrus, who is the chair of the Silicon Slopes Economic Response Committee, and talk about how important, what we announced today is on the economic side. Jeremy.
Hey, Clint. First of all, there is no question that we've got to beat the virus, and that, like, all of this emphasis has been on testing, isolating, making sure that we can reduce contagion rate. But at the same time, the economy is getting crushed, and small businesses are in shambles. And this is a tough moment. I was on a call today with Mary Daly, who is president of the San Francisco Fed, and she said that 45% of small businesses have stopped commerce, so they're cash starved. And there are answers. There is stimulus available, and I want to be very specific to small businesses that hear this, and hopefully those on this call. We all know small business owners. We frequent them every single day until the last few weeks. The SBA has made available $350 billion, and small businesses need to act fast. Tomorrow, April 3rd, you can begin to apply for the Paycheck Protection Plan. It's up to two and a half times your monthly payroll. And as long as you use it for payroll, rent, utilities, you can actually have it forgiven by June 30th. So, apply absolutely with your local bank where you have an account. I was talking to Scott Anderson yesterday. Zions Bank has been an incredible supporter. They're making resources available. They are staffing up their SBA department to ensure that that they are ready to process. But find a bank that has digital processing, apply online, and candidly, these things will start to fund next week. So when you're feeling the crunch, the cash crunch, you can apply immediately. You can working capital is available, and it can fund as soon as next week. So let's get on this. Let's spread the word. Super important that that we let local businesses know relief is available. It is the best near-term opportunity that we can find.
Jeremy, thanks for everything you're doing. I think that's incredible. I want to thank everyone who was on this call. I believe we have Speaker Wilson. Maybe that's a good way to end this. Speaker, we had the governor, the lieutenant governor, President Adams, and we thanked you at the top for your leadership. But I'd love to thank you in person here, or at least virtually, for everything that you're doing on this front. I'll let you have the last word on testutah.com.
Well, I apologize. I was on a couple other calls before this one. I wasn't able to join you earlier, but I'm growing a beard because I heard Jeremy was growing one, and that's what all the cool kids were doing. So I thought I would. We're just trying to get the governor to grow one, and he hasn't agreed to yet, but we'll keep working on him. I don't know what you've talked about, so maybe instead of risking kind of repeating things, I will just say that what you've done is kind of indescribable to me. I've worked with the governor's budget director, Chris Cox, for years, and she's ridiculously smart, very capable, and it takes a lot to impress her. And she lacks words to describe how amazing you all are and the work that you've done in this effort. And as I talk to the company that I run and operate, at least like an hour a week at this point, I've told them about the great work you've done and the importance of testing, and it's been amazing. I imagine that President Adams, I see him there, probably mentioned this, but the legislature is getting ready to go into special session here shortly. And Jeremy teed this up, but we are very concerned about all of the issues related to this virus and how it's affecting the health of our citizens, but also the health of our economy. And we are committed to coming in as a legislative branch here shortly and doing a number of things at a state level that will, I think, synchronize really well and work well with what the federal government has done and ensure that Utah continues to lead, not just with the private sector like what you've done, but our state government continues to be really responsive. We are the best state in the country for business by a lot of measures that are objective, and we have every intention of remaining that way.
Thanks so much, Speaker. And again, thank you for everything that you've done to get us to this point. It means a lot. I'm going to end with this. We're going to be transparent. This is a startup. We're working through kinks. There will be kinks as we are rolling this thing out. These first 2 locations are just the beginning. If you have bugs with testutah.com, if you have bugs with the assessment, reach out to us. We're here to help. And every single day, we're going to come on one of these things and talk about the progress, the mistakes, the good, the bad, and the ugly, everything happening with testutah.com. And it's critical for us that you know, with the trust that's being put into testutah.com and Slope Serves and Silicon Slopes, that we are transparent with you and telling you exactly what's happening. And so that's what we plan to do. We'll be on again tomorrow to explain and give updates on testutah.com. And we also have another town hall tomorrow at 4 p.m. We do them every Monday, Wednesday, and Friday at 4 p.m. Today's was a special town hall as we announced testutah.com. I want to thank everybody for joining, everybody who talked on this thing. And if you have any questions, please reach out to us. And again, we're going to be doing this every single day. Thanks so much.